Hey, I'm Dr. Ariana Demers. I'm an orthopedic sports medicine surgeon, and I have successfully integrated orthobiologics into my busy practice so that I can provide a continuum of care and treat patients who are in the gap. The gap is this gray area in orthopedics where standard conservative treatments have not been effective, but surgery may not be warranted. And we usually tell our patients, come back when it's worse. What? These are your patients coming to you for help. Orthobiologics is that solution that can fill the gap and help you treat your patients who are in your office looking to you for help. Orthobiologics can also be an excellent treatment for frustrating problems without good surgical outcomes. This podcast will help you create the orthobiologics business that will make you love your job again. We will focus on the value of orthobiologics, patient selection, how to talk to your patients about money, office setup, and other logistics. If this is something you've always wanted but don't know where to start, join me in the Business of Orthobiologics podcast. Hi, and welcome. This is the Business of Orthobiologics podcast, and today we have Dr. Alberto Panero. Dr. Pinero is a board-certified physical medicine and rehab specialist with a subspecialty certification in sports medicine. He is the founder of the BIOS Orthopedic Institute, where he practices in Sacramento, California. He also is core faculty for University of California, Davis, Physical Medicine Rehab, Sports Medicine Fellowship. He is regarded as one of the experts in orthobiologics and musculoskeletal ultrasound and has published several papers on the topics. He has also presented research and interventional orthobiologic techniques at top orthopedic and sports medicine conferences. He's also highly involved in the sports community, serving as a team physician for the Sacramento River Cats, a AAA affiliate of the San Francisco Giants, and a team physician at Sacramento Republic FC. So welcome. Thank you so much. This has been great. And I am so excited to have you on our podcast. I wanted to know if you could start from the beginning. After training, where did you start? I know you didn't just start at BIOS. Where did you start, and how did you get to where you are now with BIOS?
Sure. Well, first of all, thank you for having me. It's a pleasure to be here and share my experience, more so on the business side of things, which I do enjoy just as much as practicing medicine. I think it started with the vision, right? And, going back to why I became a physician in the first place, I had my own sports injuries, which I felt like didn't necessarily get the best care, at the time. Looking back on it. And I wanted to be able to provide opportunities, especially for younger athletes or those who didn't have access to high level medicine, to really be able to get back on the field, right? So that was the vision. And I think I always had, kind of this idea where I wanted to have my own sports clinic and kind of wanted to be able to build, if you build it, they will come type of scenario. Little did I know it's not so easy where it's you just build it and they come. And here I am 10 years into it. And, it's been a journey, certainly a good one, but hopefully people can learn from some of the things I've done. I think where, I benefited or, kind of right place, right time. I finished at UC Davis, my fellowship, and there was a physician who was leaving. She was a full-time physician at the time, and they needed someone to kind of fill in a spot at UC Davis. And then on the other side, one of my fellowship mentors who was in private practice, who I had a really good relationship with, he was like, hey, why don't you come and start your practice here? We can work together. And thankfully, I was able to find a way where I was able to do both at the same time without interfering. And that allowed me to open up my own practice while still having kind of a part-time academic job, that paid the bills and gave me a lot of really good experience. And then from there, it's, you start to work. I was working in a private practice with 5 orthopedic surgeons, which were great. It was a great experience for me. But being like the non-operative guy or the interventional guy in the group, I just ran out of space there where I felt like in order to serve my patients better, I needed to have like a fluoroscopy unit, kind of bigger space. I wanted to build an orthobiologics lab. And that's what led to this idea of building BIOS, to be able to really help more people and be able to do more of the things I wanted to do and have the autonomy to do it. So I guess that's the short kind of pathway on how I got to BIOS.
Yeah. How many years have you been open with BIOS now? So you started in private practice, kind of half-time academic, half-time
Yeah.
with private practice, and then now you are full-time at BIOS. And how many years have you been there?
Yeah, so I ended up so we started the private practice in 2014, which wasn't officially called BIOS. And then I want to say I did the part-time thing for about 3 years. And then by 2016, 2017, I was full-time private practice. And then that took another several years to get the new space kind of found and built out. And obviously COVID happened. So I've been open at BIOS for about a year and a half now. And total, I finished fellowship at the end of 2014. So to give you an idea, 9 years, I guess.
Okay. Now, how did you know how to do this? How did you know how to open a business, and what kind of made you confident to take that big step? I mean, building out a space and going into it, and yet you are solo, or maybe we'll get into that a little bit later, but how did you know how to do this? Where did you get do you have business training, or, like, kind of share with everybody what your knowledge base going in was?
Well, I would say my knowledge base at the beginning was more just ignorance is bliss and thinking that I knew more about business than I did. And I just said, well, I really want to be able to do this. So I just started looking, okay, what are the steps, right? And kind of the first step was to get a professional corporation. So I had to find an attorney, and, I was able to get incorporated. That was kind of step one. Step two was actually to get contracted with Medicare and get contracted with all the different private insurances. And then step three is really being able to find a way to get into your local HMOs, which, I found that the hardest part, getting Medicare, getting PPOs on those panels. Obviously it's not easy to negotiate a great contract, but you can get contracted with them.
So you are contracted with all of the insurances, but you do quite a bit of orthobiologic treatments. How do you integrate that, where some of your clients are insurance based and some of your clients are cash based? And maybe share how much, like, percentage wise, what are we looking at for you?
Yeah, so we do about 50% cash pay, and then the rest is divided into Medicare and private insurances. I think what's important is understanding your contracts and understanding kind of the rules, right? For instance, with Medicare patients, making sure that they sign an ABN if you're going to do a cash pay procedure for them. With your private networks, understanding, how to get prior authorization and making sure that you go through the proper steps before doing a procedure that's not covered by insurance. And it can be a little bit challenging to navigate that, and you just have to kind of go through the steps. I think for me is obviously offering my patients options, right? And from the first visit, I say, hey, these are all your options. These are the ones that are going to be covered by insurance. These are the ones that are unlikely to be covered by insurance. And I give them the pros and cons and kind of the benefits of each. And then they kind of get to decide which way they want to go. And I always say it's not a right or wrong answer. It's really what fits more with where you're at with the process, with what you've tried in the past. If you haven't tried anything, then okay, we can maybe go through some of the traditional stuff versus where, I'm seeing things now that I feel like orthobiologics have such a good role in, that I might say, hey, we can try that, but I think this may be better because of A, B, and C, right? So I think it's just having an honest and open, communication with the patient about it.
Gotcha. Can you share a little bit about how your office is set up? Are you solo? Do you have partners? Can you share a little bit about how the structure for your office is?
Yeah, so we have, I guess it's private practice. We have a physician assistant, and we also have a part-time physician. Basically, we've gotten to the point where it's just a really good flow where, we all kind of practice under the same methodology. We make sure to kind of have the right, I guess, culture within the workplace, right, about what we're trying to communicate to the patient. So that way, no matter who they see, they're still getting the BIOS experience. It's not just they're seeing Dr. Moore, they're seeing Dr. Panero, right? Even if our physician assistant, who's great, is having a conversation, we're going to be relaying the same messages. And then also having a really open communication, right, where, hey, if someone needs to run a case by somebody, we're always there, right? Or if someone needs to pop into a room, we're always there. Then also is the support staff, right? We have a great support staff. We have an amazing clinical director. Her name is Sabrina, who basically kind of runs the whole office and makes sure everything is going smoothly. We have an MA who's also a phlebotomist, which I feel like has helped a lot in expediting especially the PRP procedures, especially if you're going to have a lab, right? And you have a cell counter and you have all these things, you need, dedicated staff. You don't want to be trying to do that all yourself. And then it's back office, right? Running referrals, getting people in, making sure that the customer service is really good, right? I think that's kind of big for like small private practices is where we can really gain is making sure that that person really feels like they're a unique individual and the customer service is on point, which you may not get at the larger centers where, you're going to call, you're going to get the runaround. It's going to take you 3 to 4 months to get in, right? So those are the things that we're trying to make up ground for.
Absolutely. Now, what do you think has been your most important business decision that's been like a game changer for you?
There's probably a few, right?
Yeah.
I think number one is, I think the decision to pick what you want to be, right? So when I came out, right, I had a really big interest in sports concussion, right? I wanted to be the concussion guy. I loved sports science and performance, right? And I wanted to do all these projects with the teams I covered with sports science. I loved orthobiologics and I wanted to be the orthobiologics guy. Then, you want to be also the guy that can do the medical side, at least in the non-operative side, right? Like the compartment syndrome, the exercise-induced asthma, these things. And I realized that there was just no way I was going to be able to be the guy at all those things, right? And I think I had to kind of slowly start to focus, and I really ended up becoming the orthobiologics guy. It's not that I still don't see the other things, but I feel like you kind of have to decide where you want to be and what you want to be really good at. Two is, I think, not caring about what other people, how they're doing it, or if they're telling you, if there's someone else in your practice. You really, I think, have to pick how you want to run your practice, how you want your practice flow to go. You want to really be able to bring in the people that are going to work with you and train them. And that means being involved in the hiring process, right? Like where you can really be one-on-one with that people. And can I really work with this person? And then from there, I think is going out to the community and really being, impactful, right? Where you're going and doing seminars, you're going to the physical therapy offices, you're going and meeting with primary care offices. That was a really good business decision where we really built a good network within the community. And then lastly, I think is knowing your numbers, right? Just from a business perspective, right? Like Marcus Lemonis says, if you don't know your numbers, you don't know your business, right? So you have to find a way to really become, dedicated to the business side of it, where you're really understanding what's coming in, what's coming out, where is it coming from, right? Looking at the people who are sending you referrals and really giving back to them, not in a kickback way, but in a way of service, right? Where you're providing a great service for their patient. And then also identifying areas that, hey, maybe I'm not getting referrals, from A, B, and C. What can I do to maybe get my name out there or do some education where we can get more referrals that way? And then lastly, I think is once you're ready for it, building BIOS was the complete game changer. It was the dream come true, having the facility that I wanted with, all the little intricacies and all the little things behind the scene that people don't see that make that flow and that process go really well. And it has really elevated our service and the way that we can help people.
Awesome. So what kind of...
Was that too long of an answer?
No, that's perfect.
Right.
I want your expertise and knowledge. So what kind of business training have you had? Do you have an MBA? Did you take some business courses?
No, I did not. I think I watched Shark Tank a lot, and I watched a couple of these business shows, and I really kind of enjoyed them. I think I've just always, it became more like, hey, if I want to accomplish this, I have to get good at the business and kind of dive into it, right? But it wasn't like I had the training. And like I said, I felt like I knew more about business until I actually got into it. I was like, wow, I really need to step it up. But I think it's about being consistent and about really trying to figure out, okay, from a business perspective, from a numbers perspective, what are the things that are really impacting my business, right? So for instance, at the very beginning, we identified that we weren't answering phone calls, fast enough. People were getting lost to follow up. It was taking a long time to get referrals in. So I really had to spend one-on-one time with that person that was bringing in the referrals and try to coach them up and find ways to make the process more efficient, right? Once we did that, it was, okay, where are we, from a cost perspective, right? Where are we losing? Are we paying too much for, for instance, waste management, our phone services, right? Like really looking at your P&L, breaking it down percentage-wise, and anything that's over 1%, you try to attack it, right? And bring that down. Process credit card fees, right? If you're doing a lot of cash pay, how much money are you losing there? You'd be surprised. You could lose $25,000 a year just on credit card fees, right? I think you have to constantly be looking at the P&L and don't feel like you just do it once a quarter and you're done. No, it's like got to be an active process, right?
And for those who maybe don't have their own business, or
Yeah.
when I opened my own business, I didn't exactly know what a P&L was. So just to clarify, P&L is the profit and loss. That's what most people who own a business know, how they know their numbers. So for those of you who don't know what a P&L statement is, it's a profit and loss statement and just tracks your numbers. I didn't know either until I opened up this book. Literally Business for Dummies. It was the yellow covered one. That's where I learned how to all of the terminology and all these things. It's like, I don't know any of this. How do you go from zero knowledge, which we got zero knowledge in medical school and in residency and fellowship. And so ultimately, how do we learn these things? Can you share with any really nice resources that you use kind of to get smart about business, or use them as a guide to help you be smarter at business?
Yeah, I think it may also be surrounding yourself with the right people. So for instance, with, P&Ls and balance sheets, right? Yeah, you can sit there on a Saturday and try to reconcile your accounts, right? But it may be worth just investing in a inexpensive bookkeeper, right? That can really, take care of it for you. And therefore it's there, it's organized. You can make changes to it and it's much more efficient, and you can just evaluate the results. Finding a good business attorney, right? Finding a really good accountant. I think it's really setting up the team around you, right? And remember that if those services are not working out for you, don't be afraid to reach out and change them, right? Where you can get, I've changed accountants, I've changed attorneys, just like people sometimes change doctors, right? You got to find the ones that are willing to work with you. As far as resources, to be honest with you, I really haven't used books. I'm more of like a watch TV guy. So I've just been on the business channel and trying to find ways. But also I say, speak to your friends, right, that have businesses, and hey, how are they doing it? Another good acronym, I think, is ROI, right? Return on investment. And understanding how to calculate, okay, if I'm going to spend, $5,000 a month on Google ads, how many patients do they have to see me? And I have to convert into a patient for that $5,000 to make sense, right? And I think anytime you're going to invest money, I don't know, you're going to get a new shockwave machine, right? Okay, it costs X amount. How many patients do I need to see before I pay the machine off? And where does that become profitable, right? And I think that really understanding, again, profit and loss, return on investment, and what's another one? And also, I think from a financial standpoint is when to take out money, right? When to take out a loan, understanding your interest rates and how you're going to pay off those amounts. I think if you can do those three things right while keeping really high level customer service, you're going to do well.
Awesome. So you say your practice is about 50% orthobiologics. Have you always had it be 50% orthobiologics, or has it kind of ramped up over the years?
Well, I would say it's 50% cash based.
Okay.
I would say, I've always been a fan of I didn't just want to be an orthobiologic clinic. I wanted to be able to provide all the services and orthobiologics kind of be what we're known for and kind of the staple of the practice. So it is that, right? I think a lot of people, within the community, we are the orthobiologics clinic you come to, and therefore people are seeking us out and coming directly for that. And then for the rest of the population is, offering it as another option. It's just another big tool that we have in our box, right? But it does take some time, right? I would say that that didn't happen overnight and probably took a good, 3, 4, 5 years before it really became that. And I would say, just in general terms for people who are listening, that's how long it likely takes, right? The first 1 or 2 years are, kind of up and down, especially if you're solo and you don't have like an immediate influx of patients from somewhere else, like a private practice or an academic center. And then by year 3, it really starts to kind of plateau and kind of get like where you're consistent. And then by year 4 or 5, that's when you see a lot more growth, at least I did. And then it's just about really trying to, okay, how do I keep this rolling? How do I not get overwhelmed? And making sure that you build a structure or a scaffold in your practice, right? That's strong enough to sustain that, right? Because if you don't do that early, as you start to get busier, your customer service and your ability to see people, will essentially crumble you, right? So that's why I think it's really important at the beginning to have spend the time with your staff, building processes, building ways that the things are going to be efficient, that if I increase my volume, my staff and myself can still sustain that. So I think that's a really important piece.
Great. Yeah, thanks. What do you see as the main benefits of integrating orthobiologics as an option in your practice?
I think it's what starts with the science and the benefits to the patient, right? It's another pathway. For a long time, we've been using, physical therapy, which can be great, steroid injections, medications, braces. And if they failed that, it was kind of a surgical intervention, right? And I feel like with orthobiologics, we just now have another pathway. In a lot of scenarios, it can actually heal things, like small tendon injuries, tendinopathy, muscle injuries. And in other things like osteoarthritis, it's just a better, almost like chronic disease management, right? Where, hey, okay, you may not be curing the osteoarthritis, but it's much better than, for instance, a steroid injection. It's been proving to be better than hyaluronic acid injections. And it's going to give you longer, better pain relief. And there's nothing wrong with that. I feel like, the stigma behind orthobiologics is when it first started, it was all about this, hey, we're going to put this magic PRP or stem cell in there, and it's just going to fix everything and regrow your brand new knee. And now that we've done it for a while, we're starting to see, okay, where are the things that it can actually heal things, right? Versus where, hey, osteoarthritis is a chronic disease, and this is just another better management option. So I felt like, to me, it was just a natural transition to provide a patient a better option. And that's how we were able to integrate it with the practice.
Awesome. So can you just share kind of from a day-to-day experience as a business owner, how do you spend your days, like Monday through Friday? I know, at some point, if you're running a business, you have to have some administrative days as well. Can you kind of share how you spend your days?
Sure. Well, now, with the help that I have and been able to build BIOS, I have been able to carve out about 2 to 3 half days a week where I'm doing primarily administrative stuff. And that can vary from, having meetings with my clinical director, going out. I still go out personally. I'm a big believer in still going to physician offices, going and thanking referring providers, making sure that the process for them sending us patients is still fluid. I'm a big proponent in that and still showing my face. And then lastly is the, running the business side. I think you have to stay on top of the numbers, seeing what the business is doing, making sure that the numbers are still doing well, and identifying areas of improvement. And then for practice, what we've done is we kind of segmented where, for instance, Mondays are our fluoro days, and we're just doing all the fluoro cases that day. Wednesdays and Thursdays are our primary orthobiologic days. And then the rest, we do a mix of new patients and follow-ups.
Great. Awesome. What did you see was a challenge, either personally or professionally? Like, how did you do this business owner part, as well as working as a physician in your business, as well as having, your family and loved
Sure.
ones? Have you come up with any like hacks to make that easier, or is that something we all struggle with? Maybe just if you can share that, that'd be great.
Sure. I think it is very challenging, and it's probably one of the, as you know, one of the hardest things, right, to balance it all out. For me, I've just always tried to put my family first and really devote, dedicated attention to them. And if that means, waking up earlier or staying up later, but still making sure that, I still am able to be very present with the family, right? Because I think that that's, at the end of the day, what's going to lead to the ultimate happiness. Now, from a business perspective, I think, unfortunately, at the beginning, you just have to be willing to grind, right? And willing to put in the time and the hours and just kind of staying on task. And I think one of the best things you can do is just be ultra organized, making sure you're constantly checking and rechecking, whether it's your task list, whether it's your schedule and your calendar, and making sure that you can stay on task, right? And don't, especially when you assign tasks to your staff, don't just tell them something and then pretend it's going to get done, and then 6 weeks later, it's already finished, right? Same thing with your consultants, like your attorney, or for instance, in my case, if you're building out a project, right? Like, you really have to stay on top of everybody, right? Like, building out BIOS, was a big challenge. And I learned that I had to stay on top of, the attorney doing the work, the landlord following up on their promises. When you go to get your general contractor, making sure that you're checking in and consistently following up on the project. Because, what happens is you're like, well, I don't know anything about general contracting. I'm hiring him. You just expect him that he's just going to do his job, right? Unfortunately, it doesn't always work that way. And you have to advocate for yourself. And anytime you hire any of your consultants, even your accountant, you want to be consistently checking in and kind of following up on their work, not, assigning a task and then hoping it's done 3 months later. Unfortunately, you have to stay engaged through the whole process.
Gotcha. So what information do you wish you had at the outset of your private practice journey that would have been super helpful going in?
Yeah. Well, I think one, how long it's going to take, right? I do feel I've accomplished a lot and I'm very proud of it, but it's a slow process, right? And the years go by and you're in it, right? I would say, grow out of necessity, right? If you're not ready to take the next big step and you're in a place where you have low overhead and your costs are low and patients are coming in, don't be afraid there to stay for a little while, right? And build up the reputation, the nest egg, and then take the next step. Don't feel like you have to open up, the big thing right away, right? You can definitely stay in kind of a smaller model for a little while until it grows. The other thing is, to the point I was making, is when you start to go into business, right? It's a cruel world, right? And working with landlords and real estate and different contracts, you have to be prepared, that as a small private guy, you're not going to have the leverage that you may want, right? And even though you're going in it in good faith, right, to do things the right way and maintain on your promises, the other people that you're working with or against may not be, right? So be prepared for that. Be prepared for the fact that, for instance, a landlord may have a lot more, you both signed the same agreement, right? But the landlord can have a much bigger leverage to make you comply on your terms of the agreement while they sign the same agreement. But in order for you to make them comply to their agreement can be a lot more challenging, right? So just beware about that and make sure that you really, really have a good attorney and someone who's really going to be looking at things in your favor.
Awesome. What advice would you offer a physician who is contemplating adding orthobiologics to their existing practice?
Well, number one, do it for the right reasons because you believe in the science and you genuinely feel that these are the right things for your patient. Two, be meticulous about learning the science behind it. I think sometimes we forget, or I didn't realize how much basic science went into understanding these procedures. And if you do that, you're going to be able to really understand why you're doing these procedures, which leads you to then pick the right patient candidate, right? And make sure you're not just injecting everybody with everything, making sure that you're trying to really be meticulous about who you inject, how you inject it, and why you're doing it. And then lastly, a plug here, go to the good courses, right? IOF, for instance, try to shadow some of the physicians that are doing it. Try to really be as evidence-based as possible behind it. And there are a lot of really good resources and a lot of good people that are willing to share their knowledge. So why not tap into that?
Awesome. So if people want to know more or want to get in contact with you, how can people reach you?
The best is through our website, theBIOSinstitute.com. Also, we have an Instagram handle that we try to update as frequently as we can. As you know, running a business, that's another side we could probably have a whole podcast on, right? Is social media in the era of medicine. But yeah, I think those would be the two best ways to contact us.
Awesome. Well, thank you so much for joining us. This has been Alberto Pinero, and this has been the Business of Orthobiologics podcast. Thanks so much, and we'll see you next time.
All righty. Have a good one.
This has been the Business of Orthobiologics podcast. Thank you so much for joining us today. If you want to know more, please join us on the website prp-now.com and click on the free masterclass. Also, don't forget to subscribe to this podcast to get more guidance on integrating PRP in your busy practice. Bye for now.